our abdominal aorta bifurcates at the level of fourth lumbar vertebra into two terminal branches. One is arteria iliaca externa, arteria iliaca communis on the right side and on the left side. Sometimes we can meet one more artery. We just start just above this bifurcation level. How this artery is called? Arteria sacralis mediana. This artery is not constant, is not permanent. In most of cases, this artery is absent. But you have to remember about this artery. It starts from the posterior side, posterior angle of the posterior surface of the bifurcation. This artery is very thin. This artery is rudimentary because in animals it supplies the tail. But because we lost tail, this artery also becomes like rudimentary. But sometimes it can be present, and because this artery starts from aorta, which has very high blood pressure, of course this artery also is very dangerous. If you will carry out operations on the organs of true pelvis, very easy to cut this artery. And because of very high pressure, we can lose the patient because of bleeding. That's why in all cases, please remember that this artery is in patient's body. Don't forget about it. Then, arteria iliaca communis. This artery doesn't give any branches. No branches will start from this artery, same like from arteria iliaca, from arteria carotis communis. At the level of promontorium is here. Do you remember what is this? This angle, the protrusion between fifth lumbar and first sacral vertebra. At the level of promontorium, arteria iliaca communis is divided into two terminal branches. Bifurcates. First one goes to the thigh, and this artery is called arteria iliaca externa, but another goes to the true pelvis, and it is called arteria iliaca interna. Arteria iliaca externa, it goes downward and then it continues into femoral artery. What is the borderline between them? Borderline is inguinal ligament, ligamentum inguinale, not lacuna vasorum, like usually you tell, because lacuna is opening, but opening cannot be borderline. But inguinal ligament is borderline, and this is very important to know, because just above this inguinal ligament, arteria iliaca externa gives off two arteries. Arteria iliaca externa give just two arteries, just two branches, and both of them start just near inguinal ligament. Look, one artery goes to the lateral side, another goes to the medial side. Also very easy to identify them. Artery going to the lateral side is called arteria circumflexa ilium profunda, artery which goes around the ilium, around the iliac crest. Another artery goes to the medial side, medially, and then it ascends up to the region of umbilicus. This artery is called epigastrica inferior. You remember arteria epigastrica superior, which start from thoracica interna. So in the region of umbilicus, these two arteries unite together to form anastomosis. So did you understand this? Well, internal iliac artery. Internal iliac artery has many branches because a lot of structures are in the true pelvis, and many classification, many division of these arteries. According to some textbook, we can divide these arteries into parietal and visceral, same like in abdominal aorta. This also can be useful information, very useful division, parietal and visceral. But in most of textbook, branches of internal iliac artery, first of all, is divided into two trunks. First one is truncus posterior trunk, which is larger, which is bigger, and truncus anterior, which is smaller. Truncus posterior trunk, it gives off just three branches, but one of them is the largest branch of true pelvis, which is called arteria glutea superior, superior gluteal artery. What does it supply? Muscles, gluteal muscles. Gluteal muscles are the largest structures in the region of pelvis. That is why this artery, the arteria glutea superior, is the biggest artery of the true pelvis. And of course, gluteus muscles are outside of pelvis. That's why this artery also must leave the pelvis, and it leaves pelvis through the foramen, which is called foramen suprapiriform foramen. Then another two branches are very small. Another two branches, we start from posterior trunk, are small. First one, these branches, I draw two. Sometimes it can be only one, sometimes two, sometimes four. So very variable artery. How can you find this? This is the only one artery which goes to the region of the sacrum, because all other arteries goes in front to the internal organs, but this artery goes to the sacrum. That's why it is called arteria sacralis lateralis, lateral sacral artery. And one more, when you find the biggest artery, when you find arteria sacralis lateralis, next artery, last artery is called arteria iliolumbalis. How can you identify this artery? How can you find it? There is only one artery from the posterior trunk or from the internal iliac artery which goes to the lateral side, out of true pelvis, because all branches goes to the true pelvis, and this only one which goes out to the lateral side. This artery is called arteria iliolumbalis. It goes laterally, just behind common iliac artery, and then it is divided into two branches. Two, arteria iliolumbalis. Logically, it is divided into ramus lumbalis, which ascends and anastomosis with arteria lumbalis from abdominal aorta, and another branch is called ramus iliacus, which goes to the region of iliac crest and anastomosis with which artery? How is it called? I told you.
Profunda, Illiaca profunda.
Circumflexa humeriantorum. Sorry, ilium profunda, you are right. Arteria circumflexa ilium profunda. And now I get this anastomosis, which is very important for collateral circulation of the leg, of the lower extremity. This anastomosis between arteria iliolumbalis from posterior trunk from internal iliac and circumflexa ilium profunda from external iliac artery. So that's why posterior trunk usually gives off just three arteries. One of them is the biggest artery of true pelvis, arteria glutea superior. Another, the only one artery which goes to the lateral side, iliolumbalis. And last one, the only one artery which goes to the sacrum, arteria sacralis lateralis. So you can see that very easy identifies the branches of posterior trunk. So all other arteries start from anterior trunk. Anterior trunk. How these branches I can identify? Also very easy way. First artery which you can identify very easy is artery which goes to the canal, which is present in anterior wall of the pelvis. This artery goes to this canal. Do you remember how this canal is called?
Femoral canal?
No. Canalis obturatorius, obturatory canal. So this artery is called arteria obturatoria. How can you find this artery? Of course, you can find this canal, and which artery goes to the canal is called arteria obturatoria. But usually, this artery goes to this canal together with nerve which passes along the medial side of the external iliac artery here, and this nerve is called nervus obturatorius. Very easy to find this nerve because there is only one nerve in the true pelvis, nervus obturatorius. You can follow this nerve, and when this nerve enters the canal, you should find artery which goes to the same canal, and it will be arteria obturatoria. Then, next artery which also is very important is called arteria umbilicalis, umbilical artery. This artery is the most superior branch of internal iliac artery. Why? Because logically it goes to the umbilicus, it must ascend. That's why this artery is the most superior. This artery is working only in fetus body. After birth, when doctor cuts the umbilical cord, blood cannot pass through this umbilical artery, and this artery begins to obliterate, and it is transformed into ligament. Which ligament? Which one? Medial umbilical ligament which forms plica umbilicalis medialis, which goes to the umbilical region. So that's why after birth, this ligament begins to transform in this artery begins to transform into ligament. But the only small place remains. Very small part of the umbilical artery remains. remains a lumen, remains a cavity, and this part is from beginning to horizon of the artery which goes to the urinary bladder. This urinary bladder, this artery is called arteria vesicalis superior. So usually superior vesical artery supplying the upper part of urinary bladder, starts from arteria umbilicalis. And if in your patient you will find superior vesical artery, we start from arteria umbilicalis, you must remember that this part of arteria umbilicalis is working, it contains blood. After this artery, you can cut, after this arteria vesicalis superior, you can cut umbilical artery and nothing will be, because it's ligament but not artery. But before you cannot cut because it contains the blood. Understood? Understood. So these are the basic moments. All other arteries you will study yourself, they are not so deep.